afternoon, everyone. I thank Mr. Naya and Dr. Rajiv to give me an opportunity to share my research work. This research work, me and Professor Sunita Reddy conducted together, started in 2005, continued in 2008 and 9. It's based both on secondary data resources and also primary research work. We conducted interviews with doctors in 3 cities, in 2 public hospitals and 2 corporate hospitals. Cities were Delhi, Hyderabad and Chennai. Because Chennai we couldn't talk to the public hospitals because there the government or the authority there, they said they had a very bad experience previously about writing negative about government hospitals in media, so they were very apprehensive, so they denied us permission, so we couldn't carry on with that. But then out of these 3 cities and interviews with doctors, with 90 doctors we interviewed, both from public and private, we wanted to look at their perception, understanding about medical tourism and what they see as a scope of medical tourism in India, and if they see any link between the implications of medical tourism on the inequities or the healthcare for the poor. So these were the major objectives of our research work. So today I'll be looking at some of the questions which we like to address here, and I think by the end of this presentation maybe you will be able to know what is medical tourism, why India is a medical tourism destination, what are the push and pull factors for foreign patients to come to India, what are the policy shifts which have promoted medical tourism, who are the major players in medical tourism, how is it promoted and why, now what are its implications in Indian healthcare services systems. So there are so many questions, I am not sure I will be touching on most of them, but then if you have further queries we can discuss later. And in fact I had circulated 2 articles, if I am not sure whether you got it. One is the EPW article which has been published on medical tourism, another paper on public-private partnership and medical care in Delhi, published in Social Sciences. So we can look at those 2 papers to have further clarifications. Now when we look at medical tourism, we like to see in a framework of GATS, that's General Agreement on Trade and Services, which is having 4 modes. Of course, we'll be looking or concentrating on medical tourism. Here, cross-border supply, one can say an example is also telemedicine or other expensive equipments which may divert the funds away from provision of basic healthcare services. I'm just giving one example, but I'll focus more on medical tourism. Second is the consumption abroad, which is medical tourism, where patients travel abroad for medical treatment, which may lead to upgradation of services and facilities for foreigners, funded from the budget for the provision of domestic healthcare services, raising questions about equity and efficiency. Now, third mode is commercial presence of, say, FDI, that's foreign direct investment in the commercial firms, with higher level of pay and better equipment and premises for the professionals, which may entice them from public facilities, which is also called quote-unquote internal brain drain, because earlier professionals used to go to the West. Now they say because the private sector and corporate sectors, our doctors are not leaving our country, but they are going to private sector. So it's called internal brain drain. The health system may become or be reinforced as a 2-tier system. The best of medical care for the rich and elite, and the poorer services for the poor, or maybe no services for the poor, with high quality care for rich and poor quality for poor. And the fourth mode is the movement of natural persons, that is migrating in one direction from lower to higher level of development. So it's a migration of nursing staffs or migration of medical doctors from developing nations to developed countries. Ultimately, this amounts to poor countries subsidizing the health sector of richer countries, hardly an equitable or desirable situation. Now, views about it, some scholars envisage that trade in health services can have positive impact on national health systems in a variety of ways. Foreign investors can bring in additional resources, new technologies, and new management techniques that can improve the provision of services and financing of the system. These can improve working conditions and therefore reduce the health professionals to leave country. However, it is said that the trade can be harnessed to benefit the whole system only by strengthening of stewardship and regulatory functions of national governments. So this is a very dominant view that medical tourism or FDI or any other intervention can bring best of resources to India, so thereby discouraging our professions to go abroad. However, there are other studies which have shown that economic benefits from trade are concentrated in large business and individuals who are already wealthy. Commercial activity predominantly benefits individuals and corporate wealth at the expense of social objectives such as expanded primary care system. Now, the whole paper in today's presentation also shows that the general understanding that whatever foreign currency you're going to earn will have a trickle-down effect on Indian healthcare service system, and that overall the health services will be improved, which is largely a myth. Because most often the economic benefits or the financial benefits which comes to are largely with the individuals or the corporate sectors who are the owners of the hospitals. Now, to understand what medical tourism, often medical tourism and health tourism are interchangeably used. However, there is a difference in the sense medical tourism is more related to the interventions, the biomedical interventions and surgeries conducted in hospitals, whereas health tourism largely catered to other indigenous say services like Ayurveda, Unani, Siddha, Yoga, for which also there are a lot of foreigners coming to India for say chronic problems which may not have solutions in biomedical practice. However, there is a lot of debate whether we can call it medical tourism, because how difficult it is for a person who's a patient who's coming for treatment can go around travel or tourism. So this is another dimension to it. However, what are the reasons for India to take up medical tourism? One, that it offers world-class medical facilities. Second, comparable to any of the Western countries in terms of expertise, in terms of skills, with state-of-art hospitals, that's technology, and best qualified doctors. Best infrastructure and facilities, and the most important is the cost or the competitive prices. Now, all these factors together make India as a major destination for medical tourism. Now, Ministry of Tourism and Culture, Government of India in 2010 listed almost 160 hospitals across the country, and AIIMS was the #1 hospital which was listed in these 160 countries as medical tourist destination. Now, there were also other public hospitals in Bangalore, Hyderabad, which have been listed, which have a specialized treatment. Now, government wanted public hospitals to open up for medical tourists, have a private wing, or have one full floor for foreign patients. But these were again some of the questions we tried exploring with the doctors as to what they see, whether this kind of dual system within public services can really work in India. Now, why again this medical tourism is being so much promoted or propagated? Largely as a business proposition, because CII, Confederation of Indian Industry, and McKinsey Company estimated medical tourism market growing at the rate of 15% for the past 15 years. So it's a huge industry. By 2012, medical tourism were to reach 25% of revenues of private market players. Up to rupees 10,000 crores will be added to the revenues of these players. So huge potential for us to earn foreign exchange. Now, health as a profitable quote-unquote trade industry, not just for health professionals, but a motley of other investors, businessmen, jewelers, hoteliers sharing the pie. So till say 85 or 90s, they were mostly the medical professionals who got back from the West, established themselves and established their hospitals. But if you see the current scenario, most of these corporate hospitals are owned by the business class, and they were either the hoteliers or jewelers or any other businessmen who have now opened up large, big hotel-like hospitals, which are called corporate hospitals, and they are hiring doctors instead of doctors being owners. So there are a lot of implications to have such a model where it's being basically a business proposition started by businessmen, because then again the bottom line is to have profits. So it's not in the hands of professionals to follow certain ethics to follow up with their treatment. But when it comes to the hands of business class, they just want profits at any cost. So then it dictates the medical professionals or the doctors to compromise maybe with their ethics or many other issues, and thereby leading to commercialization and over-medication, over-diagnosis in the hospitals. Now, the most important factor to promote medical tourism is to showcase the cost differentials. As I said, that's the most important for why patients are coming from other countries, which is around 1/10 in the developing nations, to exorbitant prices in developing nations, offering a business and a value proposition. And there are captions which says, first world treatment at third world rates. I mean, if you just Google medical tourism, thousands of pages will open up, and you have a lot of packages and a lot of promotional slogans and captions. Now, this table gives you a comparative picture of the cost differential across countries, especially US, UK, and the provider side, Singapore and India. So Asian countries being hub for medical tourists. If you look at Singapore and India, compared to Singapore, India is even cheaper. So it's almost 1/10 of any surgery or any treatment you take across. India has a minimum cost. So this is one important aspect for why tourists or medical tourists coming to India for treatment. Now, what are the kind of services which are provided under medical tourism? Definitely not the emergencies. So it's mostly the elective surgeries which are conducted. Services which are largely like knee joint replacement, hip replacement, largely orthopedic. Then there are bone marrow transplant, bypass surgeries, breast lump removal, hemiparectomy, if I've pronounced correctly, cataract surgery, IVF is another important treatment, surrogacy, cosmetic surgery. So these are the services which are under the medical tourism getting a lot of importance. And again, not just the treatment, but the persons who travel along with the patients are offered, say, very subsidized or maybe compared to their own countries, a preventive checkup. So this is an added advantage, or to entice the patients and their family members to have a checkup, which is so cheaper when compared to Western countries. Now, at this point, I wanted to just indicate that in South Delhi, if you look at, there are more than 10, 15 or even more than that corporate hospitals. Now, where do you get so many patients? Because there's so much of competition among themselves. So definitely they have to open up their own services for not just the rich or the elite or even the organized sector government bodies, because the CGHS again can opt for these services in these corporate hospitals, but open up for the international medical tourists. So thereby, there is no proper distribution of hospital services, the super specialities and the tertiary sectors, but they are clustered, especially in South Delhi, in Delhi, but similarly they are in most of the metros in India. Now, if you look at history of medical tourism in India, though we call it now a medical tourism, but this has been there for the last so many years, India has been drawing patients from neighboring countries which lack these medical facilities. Especially Delhi, we've been getting patients from Pakistan, Nepal and many other neighboring countries because of good health services, not the private and corporate but the public hospitals. Like most of the patients from Bangladesh, Nepal, Pakistan, Sri Lanka were coming to tertiary teaching hospitals like AIIMS and other good public hospitals in other major cities. So Sri Lanka was becoming to Chennai and many other southern parts of cities. So traveling of patients coming from neighboring countries was there for a long time, but that was for another reason, that the services were not available in their own countries. And for better services they were coming to India, and they were coming to public hospitals rather than corporate hospitals. Now the corporatization of medical care has brought it with it 5-star facilities and world-class treatment, high-tech medical facilities, and have become necessity following consumer demand among the world's fastest growing middle class. So one, of course, is the elite and also the world middle class who can come to India from other countries for these high-tech world-class facilities. Now, 4 metros, that's Delhi, Bombay, Chennai and Calcutta. Apart from that, other cities like Hyderabad, Bangalore, Goa, Pune, Ahmedabad are also following the trend. And Goa specifically because it has direct international flights. But there are other cities, and especially Bangalore and Hyderabad are opening up international airports, have started getting much more space stations compared to earlier times. So this is a world map having countries which are going in for medical tourism. Like mostly people from USA traveling to Brazil, or European countries going to other countries which are known for good treatment, and a lot of other countries in Asian countries where people are traveling not just from US, UK but Middle East and African countries. Now, if you look at medical tourism in Asian countries, Thailand, Singapore, India, South Korea, Malaysia are attracting a combined 1.3 million medical tourists per year. Now, the estimated worth in Asia alone is at least $4 billion by 2012, and India attracted an estimated 500,000 medical tourists in the year 2008-9. Now, Singapore estimated 300,000 and more than 1 million in Thailand. Thailand made its name as a medical destination in the 1970s itself, and one single hospital called Bumrang was the one which provided services for the medical tourism. Now, Thailand is also known for sex change operations, or more formally known as gender realignment or reassignment surgeries. Now, if you look at who can afford it, all the patients in India who are elite, those who have health insurance, private insurance or CGHS, refer to the private tertiary hospitals in India. Now, this is again state buying health services from the private sector. So, few years back, CGHS card holders were able to go only to the public services. But of late now, CGHS card holders or all the central government employees can go to any of these corporate hospitals for getting services. So if you look at how, in a way, the public services are again what you call buying private care, thereby further helping the private sector to grow. Now, rich patients from the neighboring countries who do not have standard medical systems, lack of good doctors, facilities in their own countries are the pull factors. So one large segment are the patients who are in the neighboring countries who are coming to India because they don't have services in their own countries. Now, the other factors are the push factors, like Middle East after 9/11 incident in USA, because of difficulties in getting or restrictions in visa. So a lot of now Middle East patients are coming to India for treatment. And there's another push factor for people from US, UK, though they are not coming in large numbers, but whoever is coming because of the high cost private sector or high cost medical expenses in USA and a long waiting list in NHS in UK. So these are some of the pull and push factors why people are traveling to India for medical services. Now, very interesting is the advertising and packaging, as to how we advertise or how all of us, not just in India but other Asian countries, are packaging medical tourism as bright sun, blue sea, cosmetic surgery. Very interesting and captive captions, where the cost saved on one MRI could pay a return ticket. Medical tourism is bound to boom. So in USA, one MRI cost will help a person from travel to India and go back. Now, medical treatment in USA is equals to a tour to India plus medical treatment plus savings. So you can imagine the cost differentials and how much money you can save, especially patients who don't have any insurance in USA. Definitely would like to travel to other countries in order to save some money or at least to get some treatment. Medical tourism, sea, sun, sand and surgery, your wealth is our wealth, and this is the last caption, which is very, I didn't like the caption, but I put it here because that's how it is being promoted. Now, what are the constraint services which have been started? In order to make it easy and make it more convenient, there are kiosks at the airports to facilitate patients coming from other countries, airport transportations, bank transactions, medical visas. Now India has medical visas separate from other normal visas, and cheaper airline tickets. So all of them have helped to promote medical tourism. Then there are interpreters for various languages, because a lot of patients coming from other countries, so hospitals hire interpreters. They have stocked up prayer rugs and opened a kitchen serving religiously accepted halal food for Arabic patients. And then there are also proposals of having helipads on the hospitals, because the one big deterrent all the doctors felt was the transportation from the airport to hospital. And because patients traveling from other countries need immediate care, so to avoid that, some of the hospitals plan to have a helipad on their hospitals. Now there are a lot of websites and medical tourism packages all around with good testimonials. If you read those testimonials, it shows that if you enter into the hospital, you feel like you are in a developed nation. You don't see anything else, because the hospitals are like hotels and very well maintained, posh decors and good fragrance, and it doesn't look like a hospital at all. Now, apart from the biomedical practices, now the hospitals are integrating holistic medicine. That is again to entice patients if they want other services like Ayurveda, yoga, naturopathy. Having a wing like Rockland has a Shushruta wing which caters to all these other alternative systems. Now, that again shows it's more like wedding, religion and science. So opening up a small prayer hall in the corner for patients to pray for their close members. Now what's happening, what is the shift and how we see this shift? State has been promoting directly, indirectly since 1960s, and the private sector grew leaps and bounds. So India always had this private sector, but it got much more growth because of these state-led policies. Now, post-liberal era, big private hospitals transform into corporate hospitals. Now, 10th plan onwards, there is a very clear indication asking Indian government, Indian hospitals to open up for patients as a global medical destination. Now, how it's being promoted? By giving land subsidies, by giving tax exemptions, by buying private services, like I said, CGHS. Now, most of the big hospitals in Delhi have been given land on throwaway prices. Few hundred rupees in 70s and 80s, getting 5 acres or 7 acres, and as Dr. Amol said, they had put a condition to treat poor, but that never got implemented. Now, however, of late, when the authorities realize that it is being misused and they are not following it, now they have auctioned the land. Now the current policy is not to give land on subsidies, especially in Delhi. I am not sure about other places. But in Delhi they are no more giving on subsidies, but they said now it will be auctioned, the land will be auctioned, similar to the schools. But the point is, the moment it says auctioning, it will again go into the hands of bigger players. So the middle professionals or doctors or the middle business class, if they want to open a hospital, they can never do it. Now that's one aspect. But promotion of medical tourism is also under the medical diplomacy. That we should have a diplomacy or diplomatic relationship with our neighboring countries, with our other countries. So we are opening up our medical services for the foreign patients. Now, tourism departments of states and health departments are promoting medical tourism in some reputed hospitals. Not just the central government, especially the tourism department, not the health department, but every state is trying to promote medical tourism in their own country, in their own state and the cities which are known for it. Now there is linkage with tourism and corporate healthcare, where there are a lot of linkages being formed with the aviation industry, with the hotel industries, with the tour and travel operators, and all of them come together to form packages. And there are a lot of online or web focal points which actually try and see how these linkages can be formed. So they direct the patients to come in, where to settle down, where to get treatment, where to go around and get the treatment and go back. So they facilitate all these. So they're being promoted in terms of packages. coming to the research we did and the interviews with the doctors, I'll be very brief because the paper is being sent for publication, but as and when it comes, we'll circulate that paper. Very few doctors from public hospital felt that it is awful and a crime an ordinary citizen and unethical. They all felt it was a very small number, those who felt that medical tourism should not be promoted in India. And definitely not in public hospitals, because if it is promoted in public hospitals, it's going to create a two-tier system where you have, again, division of work, so definitely you go for more private care or the paid care and neglecting the poor patients who are coming for free of cost. So, but then most of the doctors felt that we should promote medical tourism in India and we should see how we can encourage, because it's going to bring a lot of foreign currency and it helps in economic growth. Now, private hospital doctors felt that health of masses is a state responsibility. None of the private hospital doctors felt that it's their responsibility. Every other doctor said, no, health of poor is the state's responsibility. And they also said that state should take care of primary and secondary health care, and tertiary care can be taken care by the private and corporate sector. And there was hardly any understanding of the linkages of how policies have been shifting and are favoring the expansion of corporate sector and cutting the resources for public hospitals. So there is no direct link, but if you look at how the land is given on subsidies, how there are tax exemptions, this half of the medical practitioners in corporate hospitals were coming from public hospitals. So when we look at their background, more than 50% had served in public hospitals. So there is this, what you call internal brain drain, but then of course, doctors in their mid-career who have achieved a good status, who have achieved a good skill, are actually handpicked by the corporate hospital management to be brought into corporate sector and paid exorbitantly as their consultation fee. So it's again, when we look at why some of the doctors are still there in the public hospital and some are moving out, they had their own reasons to tell. Some of them said a lot of bureaucracy in public hospitals, there's no expansion, working environment is not so good, and there's no scope for improvement in terms of technology. We are not able to improve our skills. So these were the factors, and of course the family pressure to earn more and the consumeristic culture. So a lot of doctors were moving out of public hospitals. But then, why they are still there? The reason was that it gives them self-satisfaction, it gives them a satisfaction that they are treating the poor, and of course a lot of autonomy and no pressure from the others to perform or others to bring profits. So that was another reason why they stick on to public hospitals. And there are a lot of other issues which, because of lack of time, will not be able to cover here. Now, what is the false expectations? Now, how it is understood and what are the problems in that? The belief in trickle-down effect that foreign exchange will improve general health services is a farce, because there is this report of Qureshi committee report which says that none of the hospitals followed the conditions of treating the poor. So there is no way the money earned by these big hospitals can be trickled down to the public services or to take care of the poor. There is no mechanism to ensure trickle down. Instead, government has subsidized their inputs. So government has been subsidizing in all forms to these corporate sectors. Contrary to the general perception that competition is beneficial to consumers and society at large, it seems to be only a partial truth. The competition in the health sector can prove detrimental, where the profit is the underlying principle of any trade. We don't have much evidence to say how these big hospitals are performing, because most of these big hospitals are again registered in the name of research and as research organizations. But unless and until we know how much of research they are doing, or is it only the clinical practice which they are doing, we won't be able to tell. And of course, how much of unethical practices going on, over-medicalization, many other unethical means, there are hardly any studies to say that, but then given of so many hospitals around, and in order to sustain their well-maintained hospitals and the personnel, it is of course a question to ask how they are sustaining themselves. So there may be definitely certain means which are not so ethical. Now, ethical issues have become significant both in terms of equity and in the more competitive involvement of the market in medical care. Over the past decade, the Indian health system has become even more dichotomous. There are examples from other countries which are doing well in medical tourism. Like Malaysia, healthcare delivery is increasingly inequitable. It's not just in India, but other Asian countries which are promoting medical tourism are seeing the inequitable condition. And in Thailand, there is a huge drain of public health sector. So this is nothing new, but then one can see what you call two-tier system evolving. Now, if you look at the implications at a time when India is being hailed as medical destination, it is ironical that patients in government hospitals are suffering due to non-availability of emergency drugs, life-saving drugs, worthy less than $1. So over the course of your summer course, you might have heard about the poor conditions of government hospitals and the problems in access and affordability for the poor sections. Now, the richest quintile consumes 3 times more public health resources as compared to poor. Now, the whole of the subsidy which is given again is being harnessed by the richer rather than poor. It is the poor who are subsidizing for rich in terms of uses of public health resources in the country. Now, contrary to the general perception that competition is beneficial to consumers and society at large, seems to be only a partial truth. Now, the competition in the health sector can prove detrimental, where the profit is underlying principle of any trade. So all the corporate sectors are working on the model of trade, and as an industry, definitely the bottom line is profit making. Healthcare for masses is an ethical, human rights and human development issue and has to be addressed immediately. I would like to end with an illustration which actually shows the medical industry at par with IT and why so many patients coming to India. So here the bottom sentence saying that, oh, they are here to handle overseas patients coming to India. Looks like our doctors are as cheap and efficient as IT professionals. Cheap here is the, in terms of cost, getting medical facilities at a lower cost compared to other countries, and efficient. So IT and medical facilities, of course, India also, the shining India, and the lot of expectations from service sector, especially IT and medical sector, to bring in the economic growth in the context of India. Thank you, and queries are also welcome.